Hi, everybody. As you know, my name is Nick Fisher. I am a lecturer in medical education at Queen Mary University of London. Specifically, I work in the Institute of Health Science, primarily on the undergraduate program for medicine. So the aim of today's presentation is to explore some of the findings of an evaluation that we've been conducting into the blended learning program. So it's nice to say at this point that this evaluation was actually partly funded by Code. We received a teaching and research award, and the impact of that has been pretty tremendous, particularly for the students who managed to get involved into the evaluation. So they've learned, a bit like Maura was saying, about how to conduct focus groups. Also, they've now participated in submitting their first paper to an academic journal. So I think from that perspective alone, it's been very valuable. So, just to say also that this is the second presentation I've done on this topic. I did it last year and presented some interim results. So I've got 10 minutes or so to present the final results. So I'm going to be as quick as I can. So just as some context for people, the blended learning that we created was for what we call the graduate entry program. We shortened that to JEP, for JEP year 1. So these are students who come into medicine having already completed a first degree. Okay, so and typically it's a science degree, but that's not exclusively the case. However, they're all obviously older than your undergraduate students, and they all have that slightly. Part of the reason that we chose the JET program to do the blended program for was the fact that they, as they're older, they have more responsibilities. A lot of them have childcare responsibilities. And they have jobs as well to help fund their learning, because obviously as a second degree, they're not always able to get that funding. So in terms of a blended program, we thought that this would be a really nice thing to do, because it gives students the flexibility to have a life outside medicine. And for those of you who have either experienced it or know someone who's been through medicine, you know that's a very full-on degree. Also, another factor for doing this was NHS England, just been in the news as of yesterday, as we all know. NHS England funded this program, and one of the reasons that they did so was because they're very interested in widening participation into medicine. Now, we are based in Whitechapel in East London, and a lot of our students come from the local communities. And they would be perceived as being from non-traditional medical undergraduates or graduates. So as a university, we're very keen in general to reach out to the community and to the local community, and the blended program is seen as one way of doing this. So in terms of a bit more context, what does it actually look like, the blended program? So we launched it in academic year 23-24. So we've got two components to the blended degree for the JEP students. On a Monday, that's the day in which they work from home. And then they are working from home pretty much on their own. We did some research, and a lot of them actually didn't collaborate on Mondays. They did it in their own time to fit into their own needs. So on Mondays, they would be doing what we call chunked lectures. So typically, students will look at hour-long stream lectures or recordings of stream lectures, but we would chunk them up and we'd intersperse them with interactive activities, which we built using tools built into Moodle, such as H5P. We also, so there were no live lectures involved, so students were very, very free to do this when they wanted to. So it could be on a Sunday, it could be on a Friday. It just depended on what their particular circumstances were. And then Tuesday to Friday would be the typical synchronous activities that they would normally do as part of their medical degree. So that would be in-person lectures, there'd be practicals, So you've got, obviously, you've got your Wednesday afternoons when you've got your sporting and social activities. So in terms of the blending, Monday was the day in which they worked on the asynchronous activities. So in terms of the actual evaluation, we were able to conduct a couple of activities. So the first one was an end of year survey using JISC. Typically, the response to JISC surveys in our experience is very low, but we were able to encourage them to participate and actually contribute to the survey, as you can see. So, a bit too much. Yeah. Okay, so generally speaking, in terms of the levels of satisfaction with the program, 99% of the students were somewhat to very satisfied with the year one course. 71% were somewhat to very satisfied with the asynchronous learning material on the course. 70% were satisfied with the amount of asynchronous learning. 42% feel asynchronous is as effective as synchronous learning, and 23% feel that asynchronous is more effective than synchronous learning. So we'll come on to a bit more into that in a minute to talk about the thematic analysis and the reasons why they're saying these things. But generally speaking, the response from the students to the blended learning is really, really positive. However, there are some very important caveats to that you can't really pick up on surveys. So we, in addition to the end of year survey, we conducted a thematic analysis. So we conducted 2 focus groups, and we conducted a thematic analysis. And out of this thematic analysis, 3 main themes were identified. First of all was the education design of the asynchronous content. So the students were particularly concerned about the quality of the design in terms of the flow of the learning, in terms of the difficulty of the learning, and also in terms of the way it aligned with the synchronous content in the remainder of the week. There were also some suggestions they gave were that we should be supporting faculty more in terms of design, because we relied on our module leads to design the content. They were also very concerned about accessibility. So we had a number of comments around rendering the content on the devices in terms of allowing them under the Equality Act and under the standards that BCAG standards in terms of their ability to access that content. So they had a lot of comments around that. I think we fell short on that. In terms of study life balance, they really liked the way we designed it in terms of having 1 day asynchronous and 4 days synchronous content. They didn't want any more asynchronous content. They really valued coming in on the Tuesdays through to Fridays and interacting with the other students and the staff, the faculty. So they felt definitely that Monday was fine. Something that came out which was quite interesting was in terms of the financial benefits. A lot of them were talking about how much money they were able to save simply by not coming in on a Monday. So that came through quite strongly, and that did surprise me somewhat. There was also other comments around the volume of content. So some of our faculty, I think, overdid it in terms of the volume of the content on the asynchronous days, on the Mondays, and they felt that they were expected to do too much. They were also concerned about the difficulty of that content. So they would get quite frustrated when they were expected to work through content asynchronously that they perceived as being quite complex. And they felt that should have been tackled maybe on the synchronous days from Tuesdays through to Fridays. Another couple of interesting things come up in terms of the technical aspect of things. So in terms of accessibility to hardware and software, something that we kind of didn't really think through, and something that they talked about was actually the financial affordability of buying some of the kit they need to access the content. So some of them would be sharing, for example, sharing laptops with family. So they wouldn't always have access to the laptops, for example, they would need to access the content, and also the software itself. So I think that was something that in future we need to think about. And there's a perception of medical students maybe coming from more of a sort of an affluent or middle class background. But that's, in our university, that's simply not the case. I think that's something that we should have considered more thoroughly. So in terms of the lessons that we learned from the evaluation, generally speaking, the graduate students really like the blended approach. There were some caveats to that. They want to see a better alignment and balance of synchronous with asynchronous content. So I mentioned before in terms of the difficulty of the content and in terms of the flow of the content from the Monday into the Tuesdays to the Friday. So that's a case of design that needs to be improved. They were very keen that we should support faculty more. We did provide support to faculty, but I think where we might have still fallen short was in terms of the helping them to design the content. And this, again, just to reiterate, accessibility includes the design of the content, but it also includes access to hardware and software. That's something that we need to consider. So just to finish off my lightning talk, the obvious next step is to look at, how can we scale this? This is the really critical question. So we spent a lot of time and resource in developing the blended program for the upper graduate entry course. So the graduate entry course has 14 students in a year, so it's relatively small. For an undergraduate medical degree, we have in excess of 300 students per year, so we've got about 15 to 1600 students over a 5-year program. So, and I think this is just me speculating right now. I think this is something that could potentially work. However, there are some really important questions that we need to ask ourselves. I think one of the questions is, in terms of the curriculum itself, would we need to build a completely new curriculum for the blended program, or could we adapt what we've already got? And in my opinion, I think, and now from our experience from the graduate entry program, I think it's quite difficult in terms of adapting existing content. I think if you're going to do something like this for an undergraduate medical degree, potentially we need to start from scratch. So that has a massive implication in terms of time and resource, and obviously we're all very short on that. Other considerations that we need to bear in mind, and we haven't done this study yet, but we would want to look at it more depth in terms of the learning outcomes from the graduate entry program. So we're looking at in terms of student satisfaction. We didn't really, not yet anyway, but we haven't really looked in terms of learner engagement, learning outcomes, and that's something that scale this into an undergraduate medical degree, we need to look at in a bit more depth. And there are obviously loads of really big considerations in terms of organizational issues, in terms of faculty, and in terms of professional services. There's also some really important considerations around the student voice. And I think what this evaluation has really taught us is that the student voice is absolutely critical to the success of this program. In terms of any changing curriculum, that student voice is absolutely critical. And there's also, specifically thinking about faculty and professional services teams, there's a lot of work to do with developing those staff and resourcing them appropriately. So I think there is a potential to do this, and I think it would have definite value, but I do believe that it's a step. Proving we can do it for a small scale project. To scale it up to a big project may be a step too far. Thank you very much.